we're all on the same page, no doubt about it, but I do think that it's very evident that the degree to which each of these components, the impact varies, I would imagine, by geography and where we are. There's absolutely no doubt about it. But in addition to some of the things you spoke about, I think there are environments such as South Africa, I can start there, where history and politics and where you fit into that history and its historical context has a big impact on risk of cardiovascular disease, because in many ways that dictates a lot of where you grow up, your education, likelihood of employment, likelihood that you have one or two parents, likelihood that you have HIV or TB or not, and how all those things might impact on your cardiac status and cardiovascular disease. The bulk of people get their cardiovascular disease almost 10, 15, in some instances 20 years earlier than that very small sector. So yes, I would like to echo that and just point out that it really is a huge population burdensome issue. I teach medical students, and when we talk about risk factors and social determinants of disease, I have to use an example of a single road. It's a highway. On one side is Constantia, which has one of the highest per capita incomes in the world, maybe even, and then the other is Khayelitsha, one of the poorest communities on the whole continent, literally divided by a road. Okay, and depending on which side of that road you were born on, this speaks volumes about your life history and the kind of diseases that you might come in, including cardiovascular disease. So very, very real.